Good day, all, and welcome to the Teledigm Pulse podcast, your rural health matters resource. Hear from your colleagues and industry experts on rural health issues and innovative care models that make a difference for rural hospitals, providers, and communities.
Welcome to the Teledigm Pulse podcast. Shane, we've got another good guest with us today. We're going to talk about changing the community perception of your hospital and how we help with that during some of the implementation process.
Yeah, Andy, hey, I'm really excited about this topic. Not only about a good guest that we have in this podcast, we have an unbelievable guest on this podcast, and I'm honored and excited to welcome our Chief Operating Officer, Jill Hull, to our podcast. And without further ado, I can't even say anymore. I'm just going to have to let her introduce herself to put everybody at ease here. So, Jill, could you introduce yourself, please?
I'm Jill Hull, Chief Operating Officer for Teledigm Health. I've been a part of this great team for 4 years. I'm excited to be on the podcast today.
Yeah, I'm excited about this topic, and I want to emphasize, Jill oversees all these operations and smooth launch processes for all of our programs, does an amazing job on that front. And the topic today is changing community perception of our hospitals and eliminating the notion of, quote, just being a transfer station. And I think as we talk about this topic today, I think it's important to just understand why would we even bring something along this line up, and it's really based on over 10 years of experience in this space, what we've learned with all the rural communities, in some cases larger communities that have been involved in these programs with us, and what we've learned over those 10 years. And certainly one of the things we have learned is understanding your community perception is a major factor in understanding how you're going to deploy these programs and why you should deploy these programs. And so one of the things we're going to talk about today is how do you engage your community when you do launch these programs, and how do you engage your teams, your local teams, through various strategies, both the community and your teams and the board, and what to consider when you're talking to your board about these programs. And so I think just to kick it off, we'll start with what is community perception. And as we think about community perception, one of the things that oftentimes comes up is when I'm talking with hospital administrators or C-suite folks, most of the time they have a pretty positive image of themselves and of the hospital in general. And in most cases, that's true. Mm-hmm. But in many cases, it's not. It's sort of one of those things, I think the community loves us. The satisfaction scores are good, which essentially means patients you are actually taking care of are satisfied. Mm-hmm. The question is, who are you not taking care of? And so it's always important. I always recommend really trying to engage the community and understand where they at with the perception of your hospital. What I mean by that is, if they walk in the front door of your facility, what's the likelihood they're going to stay there versus being transferred? And what I've found is, in many instances, the perception of the CEO is greatly different than what the community's perception on that is. I'll give you an example. In one instance, I left a C-suite meeting with a 25-bed critical access hospital. The CEO thought that the community engagement scores were good, the satisfaction was good, and everything was really operating on all 8 cylinders. And in conversations with a handful of community members, the consensus just among 6 people was, I do go there for some of my services, but if it's anything halfway complex, I'm going to just drive to town X because they're just going to transfer me anyway. And so I got that information back to the executive suite, and I said, here's the names. I would call them. And it was eye-opening what she learned when she engaged with these citizens. And in fact, it really perpetuated a lot of discussions on what do they need to do to engage that set of clients that they have been missing all this time. So at the end of the day, it's how do we really engage the community on this front? And are we convinced, despite perfect satisfaction scores, that we are taking care of everybody that we possibly could be? And it really does start with, number one, understanding what services can we offer that then helps us keep patients here. So first order business is doing it. What you have to do something. What are you going to do? And in many instances, it involves operating comprehensive virtual strategies as part of your program, whether that's subspecialty services, could be hospitalist programs, it could be a multitude of other things. But nonetheless, we have to do something. And so what is that? So that brings us to now that we've decided to do something about it, now how are we going to do it? Andy, how are we going to effectively engage the community? And this is a key piece of our launch process and strategy going into a program is we feel it's very important to engage not only your team, your local team, the board, and it's very important to engage the community and all those key constituents within the community to fully understand and be they understand exactly what you're trying to accomplish at the hospital, and that oh, by the way, since we have these services today, we can keep you here. Right. So I think today we'd like to talk a little bit about how do we go about doing that? How do we go about engaging the community? And I think I'd like Jill, you and Andy to kind of speak to that in terms of how we go about doing that.
Mm-hmm. Our launch team is just incredible. We have a phenomenal group of individuals who really hit the ground running right when we determine a service is going to launch in a community. And we have a comprehensive list of things that we go through, whether it be engaging with medical staff, with the new providers that will come in, whether that be encouraging referrals or just getting to know them so the trust is there, so they know that they can call on those new providers via telemedicine anytime, to community events. Andy, you've done a number of community events where you actually go on site and engage the community.
Yep. Yeah, we've engaged board, the local board, given them presentations. We often get, employee forums together. Well, they'll bring a group of employees in. We'll talk about the service. We'll talk about why you can care for these more critical patients that you haven't been caring for before, that you've been transferring, but we're going to have, people in your back pocket now. They're going to help you do this. Community forums so that they understand, if I have a stroke, I'm not just going to bypass the local hospital. I'm going to stop here, and they're going to treat me here. And I probably, chances are really, really good I'm going to stay here and recover here. So those are all really important messages that really need to come across with really any service we bring, whether it's acute neurology and telestroke, whether it's a hospitalist program or even an outpatient program, knowing that rheumatology is a service now that all of a sudden we have available in our community that I used to have to drive 2 hours to see a specialist for. Now I can see him right here in my community. So that whole perception of the hospital has to change. Hospitals are great members of the community. They do often, to Shane's point, have a positive, relationship with the community, but it can be more. We can grow it into more when we bring those services to them.
And we've done a number of things, too. I'm trying to think news spots. Sometimes communities will want to have a news spot, and we can even demo telemedicine equipment and services right there during the news spot. Or EMS agencies, we'll meet with them a lot to help understand what new services are available so they don't feel like they have to go to the next community to receive those services.
Yeah, and we've had news crews come into an empty ER room, and we've kind of played patient and brought one of our docs in on the screen to talk to the newscaster. And so we've been able to do some pretty cool stuff, even helping with writing of press releases or helping with social media campaigns, those kinds of things.
Mm-hmm.
Yeah, those are all excellent points. And I think, to Andy, to your point, too, in terms of the community engagement, or let's just take, for example, your stroke comment.
Yep.
It's so helpful for the community members to actually hear the service they're going to receive when they get to the hospital. And not only that, hear from individuals, maybe not their own hospital staff or hospital CEO, but an individual says, look, we've done this thousands of times in other hospitals. And we're keeping 73% of all stroke neuro patients in critical access hospitals, which is an extremely high percentage. In most cases today, based on most of the numbers, it's less than 5%. So this is a dramatic shift.
Yeah.
So the likelihood of admission into the hospital is just dramatically higher. So that's awesome. The other piece is on some of the community engagements is the EMS agencies. Can you speak to a little bit about engaging the EMS agencies on that front?
Yeah, especially, in these rural communities, a lot of times you're dealing with volunteer groups. It's volunteer firefighters with your paramedics and things like that. They have meetings. They have meetings in their group. We can invite them into some of the community forums, things like that. But it really is important to educate the folks that are driving the bus, as we like to say, that you don't just keep heading down the road. You got to bring them here now because we do have the ability to take care of those patients. And here's what we do. Here's how we do it. And here's why, it's a good idea.
And introducing them to the physicians who will actually be caring for the patients.
Yep.
We have such knowledgeable, really expert physicians in their field. And
Yeah.
so sharing their experience, how many patients they've been able to take care of, how many communities, to Shane's point, they're in right now, it's huge.
Yeah. And showing, right there, bring the doc right there on the cart, just like they would if they were caring for a patient, really gives people a taste of what that experience is like.
So, the EMS agencies, I can't emphasize this enough, as a critical piece. Having been in the back of a bus for a long time, this is a few years ago, we're not going to tell you how many years ago, but quite a few years ago. But at the end of the day, the EMS agencies have significant influence on where these patients go. And if the EMS agency is highly inclined to need to then transfer that same patient to a different hospital, by all means, they're going to try and go to where they were going to originally go to in the first place. So it's engaging the EMS agencies is a very big part of really any of these programs, but in particular stroke and neuro programs for sure.
Yeah, and especially in a rural community too, where, like I said, a lot of them are volunteers. They've got full-time jobs elsewhere, so they're not going to want to, take them to the critical access hospital, think they're just going to sit there for a little while. They might leave, then have to come back and transfer again. They want to know, I'm taking them where they need to go. And so we need to help them understand this hospital is where you need to take them.
Yeah, absolutely. And by the way, especially in the volunteer markets, they will absolutely prefer to take them locally if they can.
Absolutely.
Especially if they have high confidence they will not have to transfer again. So it's really important to engage those EMS agencies without a doubt. Well, let's switch gears a little bit. I know we've talked a lot about engaging the communities on a more direct level in terms of communication. Let's shift that a little bit into more marketing strategies.
Sure.
And so, I don't know, Jill and Andy, if you'd like to speak to how we kind of go about doing that.
Yeah.
Andy, you've really built a strong marketing playbook. We call it the marketing playbook. Do you want to share what's included?
So it's got a number of different kind of pre-canned modules that, we'll talk about how to engage in social media, templates with press release layouts. We certainly assist with the writing of those. Like I said, everything from social media to press releases to writing news copy for the local radio stations. Again, in smaller markets, you're not necessarily dealing with a big TV station, but you might have a local radio station that hospital really works closely with. And so getting that information out is really important to let the community know, and we help with that.
And I think another big part is building, again, that trust with the community, not only with the local providers, but with the community members. And so bringing information about the providers that are coming to the community via telemedicine, whether it be bios or photos, or again, that meet and greet, or even social media spots that say, hey, here's a little bit more about this individual, just exactly the same as you would if a new provider was moving into the community.
Exactly.
They really need to be a part of the care team as if they were physically there.
Yep. And we do that with a wide variety of our services, from outpatient services to hospitalist, acute care services as well.
Yeah, it's a huge advantage, and the more that the physicians can stay engaged on various methods into the community and into the hospital, the better. So, as many of those things that we can participate in, the better as we develop those relationships.
Yep.
In terms of the program, we're gonna move a little bit different direction here in terms of a program that's actually already operational and has been operational. Can you speak a little bit to maybe post-implementation strategies? And at the end of the day, how do we really know is our program working? Are we having success with our programs?
Sure.
We stay closely engaged, both from the launch perspective, but then beyond. So regular meetings, we have what we call a post-implementation review. 30, 60, and 90 days post-implementation. And those are really meant to, how is the service working? Are we seeing the volume that we would anticipate? Are there any technical challenges, any change management issues we need to overcome, any training things? So it's making sure that all of the prep work we did leading up to launch resulted in a successful launch. And then just making sure that it continues to see the volume that we would expect when we went in.
Yeah, and we look at those volumes like Jill said, at 30, 60, and 90 days, is the service getting used? Is it being used to the level that we've expected it being used? And that whole change management process, it's a really good time to just stop and take a look and go, okay, are the workflows right? Are they smooth and seamless? Are there some bumps we need to smooth out? Those kinds of things.
We don't want to implement or even sustain a program that's not seeing volume. So we keep close eyes on that. And then beyond the post-implementation process, we engage regularly, twice a year at least, to look at volumes, again, any issues that might come up, making sure that we're getting positive comments both from satisfaction surveys, from nurses and other care team members at the facility, as well as our providers.
Yeah, and the nice thing about one of the things I really like about the role I'm in, I'm not only doing the marketing piece, but I'm also doing a lot of the data gathering. And I can look at a service and go, that service maybe looks like the volumes have dropped off a little bit. So I'll check in with Janet Tanner, our customer success advocate. She'll make a few phone calls, see what's going on. And if we need to have a meeting, we'll have a meeting and make some tweaks.
And sometimes all it is just re-engaging medical staff or local community and just say, hey, here are the physicians. What questions do you have? What things can we answer for you to make sure that they are aware of what services are being offered?
Yeah, because, local physicians are busy and sometimes they'll forget, I do have a pulmonologist I can tap into. So it's a matter of reminding them.
No, it's important. You're not bumping into them in the lunchroom or in the cafeteria like you otherwise normally would, or they're not sitting right next to you in the med staff meeting, or you're not playing golf with them.
Right.
Did I bring that up? I did.
You did bring up golf.
Andy, how many times does he bring up golf in a podcast? Curious.
No, it's not that often. It might be.
We'll start a tally on that, I think.
We got to keep that on the down low. But at any rate, it is. It's just very important. And gosh, Jill, you and the entire team do such a great job on that. Andy, it's amazing work as always on that and collecting all that data. And I got to emphasize, he's all over that. If there's issues with the program or volumes are even a smidge low, we know about it. And it's so important to stay engaged on that front, especially, in some instances there's turnover in the med staffs or in the nursing staff or the C-suites. And sometimes the program that was getting used by that staff, all of a sudden those folks leave and it really wasn't well handed off in terms of what's available in terms of service. So it's really great to stay engaged. So I guess to kind of close this up, the question of the day is, can we actually change community perception? And I thought I would give an example of one of the communities that we in fact did change community perception down in Missouri. And in fact, you go back to one of our first podcast, second podcast, or combination.
Yeah, it was episode 3 and 4, I think it was.
Or 3 and 4, okay, so somewhere in there. So the Cox Lamar project down in Missouri, and in that instance, there was an average daily census there of 2 when we started, and the med staff's perception was it was in good shape. They were taking care of all the patients that they otherwise could be, and they really didn't need any assistance. But based on the data, it implied that they could be potentially taking care of more patients. And so there were several grassroots community engagement strategies that were deployed as part of that process. I won't get into all of those, but there was a significant effort on that front. What we found was over the course of a couple of years, the emergency department volumes increased by 30%, which I found interesting. Number one, their census was going up dramatically, and they're still carrying today census of well over 10, between 10 and 13. But the most interesting thing was the emergency department. And what we found was in the community, it wasn't like they had this surge of people moving into that community. It was a small community. They didn't have a surge of folks moving in, not a new huge industry that moved to town. But what we did find was patients weren't driving to other hospitals that they historically were transferred to. They said, you know what, I can actually stay at home if I go to my facility, so I'm just going to go there now instead of driving the hour to go to the tertiary center or 45 minutes north to a different critical access hospital. So it absolutely does make a difference. It makes a change. Satisfaction is extremely high. The numbers are great. The profitability is great. And, at the end of the day, the hospital feels like a hospital. And they avoid that sort of that stereotype of it's just a Band-Aid station.
Right.
And it really does provide a lot of satisfaction at the not only the administrative level, but really the physician level. The local providers really feel like they're part of a hospital that takes care of patients there by offering these types of services. And by the way, those services that were moved out initially there was the hospitalist program and acute neuro and stroke, both historically large drivers of retaining volumes. And so you can absolutely change community perception, but I will emphasize it takes a lot of work. This is a two-way street. You have to, actually it's a three-way street. You have to have the hospital and the nursing staff. You have to have a great team on that side that's committed to do this. You have to have a great partner in helping that hospital do this. And then you have to have the community. And if the three get together and work hard with the common initiative, boy, you can really do some great things and change perception, which I think we've absolutely accomplished in Lamar and among other communities as well.
Well, Jill, thanks for joining us today.
Thanks so much for having me.
We would like to thank you for joining us today. Our promise to you, the listener, you will be inspired or at a minimum find value in the information shared in this podcast. Please offer a comment or offer feedback so that we can improve this podcast and better meet your needs. Please remember to share this podcast with others that you feel may get value out of this by listening. And it's always helpful to subscribe to the podcast channel so that you're aware of future episodes and releases. In addition, if there is a rural health topic you would like to have covered on this podcast, please leave us a comment or you can send an email to pulse@teledymhealth.com